Marty White started volunteering at a hospital 5 years ago after she ended up in the ER with cardiac arrest.
After an hour of CPR and a lot of medical effort on the part of the people here in the emergency room, they managed to rescue me, bring me back from near death's door to back to good health. One way I felt like I could help give back was to come over and volunteer to help in the emergency room.
So every Sunday morning, Marty volunteers in the ER doing non-medical duties. She stocks rooms, moves patients, and answers questions.
If the family member has a question, they can ask you, and what I do is I sit there and I say, well, I will find out for you and I will get back to you with an answer to you. I'm just glad that I can go and help the nurses because they can always use extra hands. I feel good about coming because I feel like we're needed and I feel like I perform a service, and I enjoy coming every week.
The responsibilities of hospital volunteers can range from taking your phone calls and tending to the comfort of patients to providing a listening ear and a caring touch to those in need.
Need to lay down for a minute.
Oh, right, that's what you need to do right now.
Volunteers can assist medical staff in enhancing the human element of healthcare. They're able to do the little things that mean so much to patients.
Patients tend to reach out to volunteers. They're not typically dressed in that scrub or white uniform. Their pink coat, that cheery smile they have, they're able to offer those words of encouragement that a lot of times the staff in the hustle and bustle of healthcare don't have that extra time to stay in there with the patient or reach out to them like a volunteer can.
In most cases, volunteers can choose the area of the hospital in which they want to work, from patient care units to business offices to the ER.
There's always a need. There's always new opportunities opening up every day. We have our standard positions and opportunities that we offer, but every day there's a new challenge that we can open a door for a volunteer. And a lot of times people will come in and offer their services in a unique way that we don't know of, and we can start a new position for them.
Volunteers can come from all walks of life. The only requirement is the ability to give freely of your time.
Volunteers can be retirees. They can be the working mom and dad, the professional. They can be the mother that's home, that an empty nester that just has endless energy, that can get out and give back to the community and help. We have opportunities for students interested in healthcare. Sometimes there's professionals that want to change fields.
Laurie Spence is a stay-at-home mother of two. She began volunteering after she suddenly found herself with a lot of free time.
Both of my children are in school all day, and after we moved to Collierville, I had all day long to do nothing, and God was kind of pushing me to step out and be helpful. I just needed to serve.
After Laurie decided to donate her time, the Volunteer Services Coordinator helped her find the perfect place to volunteer.
Well, she asked me what I wanted to do, like if I wanted to work ER or, which place, and since I really didn't know, I just let her choose, and she said this was something new. Going into patients' rooms on the floor was a new thing, and she thought that I would be good at it. I told her I'd give it a try, and we'd see, and after the first day, I knew it was made for me, perfect for me.
Laurie volunteers 2 days a week, going from room to room, bringing patients magazines, ice, and extra pillows and blankets. But it's what the patients give Laurie that keeps her coming back.
They ask me, they say, you just volunteer and you don't get paid? I was like, yeah. And they're like, oh, that's so nice of you, that's so sweet. I was like, no, it's a reverse blessing. I said, the blessing's on me because I was spending my time alone and now I'm not. I can walk into a room and I can talk to 20 people in 2 hours, and if I can just bring them a Sprite, I feel great. Just that, anything that I could do. And it's small, but I like it. I really do.
For Smart Medicine, I'm Rod Starnes.
Joining me now is Community Services Manager for Volunteer Memphis, Kevin Dean. Kevin, thanks so much for joining us.
Thank you.
Tell us what volunteer options there are for those interested in volunteering for healthcare.
Well, you can always work in a hospital. You can work directly hands-on with patients, or you can work sort of behind the scenes with doing clerical work or doing things behind the scenes that maybe the hospital needs to get done, but they can't quite get it done. So
I never think of that type of volunteering opportunity, but so someone who is a secretary who wants to volunteer could continue to do secretarial work.
Absolutely. They need people to do filing and go through documents and all that.
What are the most popular jobs?
People love working hands-on with those clients, with those patients in the hospitals, and they love working with kids. Everybody that calls us wants to work with kids in the hospital. So.
But you mentioned something to me in the break about delivering flowers, delivering candy. I like that idea.
I used to deliver flowers and candy when I volunteered when I was younger, but I don't know if they still even do that. But
well, if someone wants to volunteer, what should they do?
They should call us at Volunteer Memphis. We have access to all the different hospitals and medical positions available at 523-2425. And you can also log on to our website at www.volunteermemphis.org.
Kevin, thanks so much for joining us.